start here? Are we good? Okay. Welcome to the Shawnee County Board of Health. It's June 18th, 2020, 11 a.m. And first on the agenda is presentation by Dr. Pezzino. So you're on.
Good morning, Commissioner. Gianfranco Pezzino, Shawnee County Health Officer. I will start as usual with some numbers from the previous weeks and then discuss where I think we should be going in terms of the next few weeks based on the information and the numbers that we have. As usual, this is the first slide that we always show, and that's the number of cases by week. So as you can see, we have been in the range between 50 and 70 in the last 3 or 4 weeks. Still going up and down quite a bit. So last week was lower than the week before, but was higher than 2 weeks before. So we just need to monitor that trend and see how that takes us. And speaking of trends, this is another way to look at the information in somewhat different ways. These are number of cases diagnosed per day. And then I superimpose there a trend line. So it's hard to make sense without the trend line. And, if I just show you the bars and I ask, is this going up or down? It would be hard for anybody, even for me, to understand if we are going up and down. But the line trend is created using some statistical magic that I really can't.
Is that trend line an average then of all these?
It's the trend line based on those points that are on the chart.
Okay.
So yes, it's not exactly an average. So if you took the same values and you mix them and you swap them, and you would obtain a different trend line just because of the sequence would be different. So it's not just the value, it's the way that they are ordered. So you can see that we have a very slight increase still trend to increase in the number of cases. It's not very high. It's not a steep curve. I wouldn't be surprised to see it going down in the next week or two. But, for what it's worth, that's where we are right now. I think we talked last week that we had an average increase of about 2% per day. I think we are down to about 1% per day now, which is still something to watch, but certainly we are going in the right direction.
Do those spikes correlate to days that we test or anything like that?
No.
Okay.
No, and I will show you the data on test. Well, here it is, the data on test.
All right.
This is the number of weekly tests that we've done. As you can see, pretty stable. There are some peaks that were a peak 2 weeks ago because we were doing some large testing because of a cluster that we had in a workplace, so we had to test some 100 people there. But we are really around, between 12 and 1,400 tests per week, which is a pretty healthy level for a county like Shawnee.
Do you have any problems getting tests? Are they plenty available?
There is plenty of testing available. So if you're asking about problem with the test kits, the collection kits, no, not right now. Remember, tests are still indicated only for people with symptoms.
Okay.
People without symptoms, we only do that and support that on a case-by-case basis, not individual case, but primarily for clusters, to investigate cluster of cases, say, in a workplace or something like that.
Commissioner Mays?
We had heard earlier that the problem wasn't necessarily the testing, but the rapid testing. Is that something that you're seeing as well, or would you agree with that statement?
When you say the problem, what problem?
Well, I think that there was the availability of the rapid testing in the medical settings.
Yeah.
That if they have
Yes.
an acute situation where somebody comes into the emergency room and they have to test them before admitting them, that they're having a hard time. Would you agree with that? Or?
I haven't talked to our hospital partners about that specifically, but I know that supplies were, and I believe still are to some extent, limited. I know that it was about a week ago, one of the hospitals here in town got an increase in their allowance. It's essentially it's rationed, so the manufacturers decide based on whatever criteria they want to use to send a certain number of doses to this hospital as opposed to that hospital, and that's nationwide distribution. So it went up, but I believe it's still restricted. So I'm pretty sure they could use more if they had more. The vast majority of tests that are done in Shawnee County is still the PCR, as we call tests, which requires a nasal swab, and then send it to the lab, and results are available usually between 1 and 2 days. Sometimes it takes a little longer. That's the vast majority. Unfortunately, we can't really differentiate in our chart what proportion comes from the rapid test and what proportion comes from a PCR.
Do we have any idea of what the average number of tests we do each day, or per week? I guess this is set up by week.
The average number of tests?
Well, I guess what I'm getting at is, you may have a spike, but maybe you did more testing that week. I don't know.
Well, that's the numbers.
Or is that,
Data show
or is that based on,
Slide, I believe.
are those? See, it may have gone up 4.5, but maybe there was more testing that week than the week before, so. I didn't know how that was,
I think I
how
messed
that
up
was
here.
figured.
Where's Mark?
And that concludes our presentation today.
Mark was here just a second
We
ago.
have a password for the projector.
Zeus is good.
Sorry. I obviously didn't know what I was doing.
It's just right up here. Okay, just that type of.
Is this an emergency? We need emergency management to handle it.
It is an emergency.
There we are.
There, we're back.
You want to go backwards?
Yes, so how do I go back?
Just hit the bottom arrows backwards.
Okay. Okay, got it, thanks. Then I don't need this anymore. So Commissioner, I'm not sure I fully understand your question, but this is the number of tests done per week,
Okay.
okay? And
The other slide, though.
this is the number of positive done per day, but it's by date of diagnosis, it's not by date that the specimen was collected. So no matter what
Okay.
week or what day the specimen will be collected, then when we talk to the patient, we ask when did your symptoms start, or when was the diagnosis done, and that's the data we enter here. So really, the fluctuation, we do have some fluctuations from day to day on number of tests done, but that is definitely canceled out in the weekly numbers, and it does not affect the daily numbers that are reported, because it's really not based on when the test was collected. Am I answering your question?
Yeah, I think you are, yeah.
And this is the proportion positive, so as we talked last week, it's, between 4 and 5%. It's been pretty stable for the last few weeks. That's not a bad place to be. It shows that if that number goes down too much, then it shows that maybe we are doing more testing than we need to do, or maybe that we have less virus in the community. If it goes up too much, it may mean that we are not testing enough people, and so we're only testing those with severe symptoms or more severe symptoms, and then we have a higher proportion as a result. So
You say that we're
that's a good
testing
place.
people who show symptoms are, in order to protect the most vulnerable, do we, on an ongoing schedule, test people who work in, say, nursing homes or retirement villages? Do those people get tested more often, or?
That is up to each nursing home to decide. There are some recommendations out there which come primarily out of the federal government, the state government. We talk to them. We help them set up their own plan. There have been a couple of nursing homes here in town where they decided to test everybody as a kind of baseline. We call it the baseline testing. It's a major undertaking. Even I honestly didn't understand how complex that is.
I just read about Lawrence, where they had 5 people in one facility that
Okay.
worked it up, and they tested positive, and not one of them knew they had it.
Right.
But
Right,
we
and
could have that situation.
I'm not familiar with the situation, so I don't know how those 5 people were found. If we had a situation like that in Topeka, we have more than one case positive from the same nursing home, we would definitely recommend to test, depending on the size of the nursing home, to test either everybody who's in a certain wing or building. Some nursing homes have many buildings, so before we say test everybody, want to be a
I
little
just see them as
cautious.
the most vulnerable and
Yeah.
people working around them.
Yeah. Oh, I totally agree. As a matter of fact, I hope I won't be late for the call, but I have a call early afternoon with all the nursing homes in the county to discuss their reopening plans, as we call it, based on recommendations that were issued by the state just last Friday. We have a nursing home coordinator who's been working diligently every single day, and they have weekly calls with the nursing homes since the beginning of the pandemic. So, you know, I said this before, I'm really happy that we haven't had any major outbreak in nursing homes. That may change, though. That may change, because the more virus we have in the community and more the virus is spreading to groups of people who also are employed in nursing homes, the more likely it is that it's going to spill into the nursing homes at some point.
And I guess the problem too is you could test somebody today and they test negative.
All it
Tomorrow
tells
they
the
might
person
test
is not
positive,
infected
so,
today.
yeah.
So that's why those mass testing programs are, they may be helpful under certain circumstances. It's not something I would recommend, to do on a mass scale with every nursing homes once a week. There is a variety of problems. Honestly, the couple of times we've done that, I learned a lot myself. I mean, how do you handle patients who have dementia? They are not able to not only understand what's happening to them, but it's a very stressful event. One of the nursing homes that did that was telling me they had to sedate several patients in order to collect those specimens. So it's something that when it needs to be done, it needs to be done. But we want to be a little cautious in the way we approach it so that we don't create more problems inadvertently than we solve. Now, this line refers only to the tests done through the Shawnee County Health Department drive-through, and only for the people who asked to be tested. So the drive-through has done additional testing for, especially in a couple in particular, of events linked to workplaces, and those are not reflected here. But as you can see, that the rates are much higher. So this is general positivity rate for all the tests done on Shawnee County residents. And this is only for those who go through our drive-through lane. So clearly, these people have a higher risk of being infected. These are probably people who would have a hard time to access the testing done in other sites, not because we don't have the testing kits, because they may not have transportation, because they may not have insurance, because they may be concerned about co-payments that may be present in even if they have insurance. The test itself is supposed to be free, but there is usually at least an administrative fee or a consultation fee that they are charged. So for whatever reason, they don't feel that they have any easy access to the other testing sites in the county, and they come to our drive-through, which is only twice a week. As you can see, we have almost 25% positivity.
Yes.
So, Dr. Pizzino, these people are typically exhibiting symptoms and have been recommended to have the test. And then the other number, the 4.5%, that includes people who, may be going in to get a hip replacement and they're getting tested ahead of time. So, I mean, it's anybody. It's somebody
Yes.
who may work at a building that had a case, and so they're testing the entire workforce. So in that 1,400, that's people who may not even be symptomatic at all, but are being tested because of exposure or because of a potential medical procedure or
Yes,
something like that.
yes.
Okay.
That is correct. I have to tell you, though, that the number of people that fall in your categories is very, very small. And I don't have the number. Actually, we can tease it out from our database. The vast majority of these people do have symptoms. And we know that because every time somebody tests positive, then we do our case investigation and contact trace. And in the process of the case investigation, we ask about symptoms. And we ask about date of onset of those symptoms. And the vast majority of them do have symptoms. But a small number, you are correct, small number will not.
Right.
If you think about 1,400 tests a week, I mean, how many elective procedures do we do in Shawnee County every week? I wouldn't know, but it's
Yeah.
definitely not even near that kind of
Do
number.
they test
there.
everybody that goes into that's admitted into the hospital?
No, they don't do that.
They don't.
They test only before elective procedures. So everybody that gets into an operating room, essentially. They don't test everybody who comes into the hospital. They screen them for
Yeah.
symptoms and history, but they don't test them.
What about like our jail? Do we test every we do not. We just look for symptoms and I suppose.
That's
they're
my understanding,
quarantined
yes.
They
maybe.
quarantine everyone that comes
Quarantine,
in for
okay.
Yeah.
a certain amount of time.
Oh,
Yeah.
there's,
Yeah, so that is correct. Right now with the jail, that everyone who comes in is quarantined in their own area for 14 days. And if they become symptomatic, then they are tested. And the staff there is wearing full PPE during that time.
All very good questions. So anyway, I thought this was interesting, that the kind of population we reach out with this drive-through testing is somewhat different from the general population that's tested in the rest of the county. And once again, as I said last week, I really want to give a lot of recognition to the team who's doing this. You can imagine, even though they change their hours now so that they will start early and end early, it's brutal. It's really brutal, being in the parking lot, wearing full personal protective equipment and doing that for 3, 4, or 5 hours. This goes back, I think it was your question, Commissioner Rippon, about for how many people we know where they got the infection. This is the reverse of your question, but it should answer your questions. These are the people for whom we do not know where they got it. So you can see that for last week, there was 27% of people for whom a source of infection was not identified. So another way to look at that is about 83% for whom there was a source that was identified. No, 73, sorry. That number went up from previous week. That's the second, the third highest that's ever been. And it's certainly the highest in recent weeks. That's a reason of concern for me, because what that tells me is that if the number goes too high, that there is so much virus circulating from person to person in the community that we just can't track where the virus is coming from. And that would not be a good situation. So I'm not really losing my sleep over the number yet, but it's something I want to watch very closely. As we have discussed before, this outbreak of this pandemic is not an equal opportunity one. It's one that affects primarily minority groups. You probably want to pay attention here to the blue slice there. It says 13%. That's a proportion of cases who are African American. It's gone down a little bit over the past few weeks, but primarily because we have had an increase in the proportion of cases who identify themselves as Hispanic. And many of those, when you ask about race, they also identify themselves as white. So as a result, the big slice of 70% includes probably a good number of people of Hispanic origin. Clearly, the Hispanic community has been affected disproportionately, and that number is going up. I think we were at 48 last week. It's 51 now.
what's the percentage population for African American? Is it 8% or somewhere?
I
in
think
that?
it's about 9%, around that.
I believe it was,
Correct me if I'm wrong, if anybody has a different
I believe we looked that up last week. It was right around 8 or 8.5, 9%.
Yeah, and for Hispanic, I believe it was 12%, if I'm not mistaken, so clearly disproportionate, especially for Hispanic. And again, we talked about this, it's, I think it's by far and large occupationally driven by the kind of occupations these people are employed in. And probably secondary to that is a living condition. They have larger families, they are more crowded environments, and as a result, we see a very high proportion of cases among Hispanic or Latinos. This is the number of cases, new hospitalizations per week. We went down last week, that's good. I checked yesterday because I knew you would ask me, and I believe we had 9 hospitalized patients as of yesterday between the two hospitals.
And how many hospitals? Are there 3 different hospitals that
VA doesn't report to
they
us.
don't
We just
report?
have we just have St. Francis, we received information from St. Francis and Stormont Vale. nothing really different in age group. You can see that the hospitalization is still prominent, primarily in people age 55 or older. Although we still have, almost 30% of them fall into the younger category.
What counts as a hospitalization? If they put a wristband on them and check their blood pressure, are they considered hospitalized or?
No, those are hospitalizations only for COVID-19.
Yeah, I know,
So
but I
this-
mean, if somebody goes in and they're.
Oh, I see what you mean.
What do they count as a hospitalization?
People who are admitted into the hospital. So it wouldn't be people who just visit the emergency rooms, and it wouldn't be people who are going through their outpatient clinic, people who are admitted into the hospital for whatever reason. In some cases, it may be just a one-day admission.
Yeah, I guess that was my next question is, what's the average stay? Are they in there for weeks or are they in there for 2 days? Or?
If they are admitted because they have COVID-19, they may be there for 2 or 3 weeks. If they are admitted for other reasons and say they're screened and then, or they develop symptoms once they are admitted and then they're found to be COVID-19 positive, it depends how sick they are. Commissioner Mays, you had a question for me?
Well, yeah, so on this slide, what we're saying is, so of the people who are hospitalized, 32.6% are between 65 and 74, not 32% of the people who contract COVID go to the
No,
hospital.
this is only hospitalizations,
Okay.
yes. And we do have, if you're interested, actually, we can show this next time. We have the same information for all cases. We can tell you the distribution. This is a scorecard, as a reminder, and I will repeat it every time I present this. This is not a card to measure the performance of the health department, how good of a job they do, but more to measure their capacity, whether they have enough resources to do their job. As you can see, it's kind of mixed, and we have a red for the first time since we started this monitoring on the contact tracing, and the main reason is that the health department lost some technology tools that have been used in prior weeks to do contact tracing. And it was a national program that was supported by the National Association of City and County Health Officials, was made available to local health departments. Shawnee County signed up, and then all of a sudden last week they withdrew their program. I think it's because that national organization somehow didn't get the license renewed or something like that. So that's the main reason. I don't know if there is anything else we need to add to that.
And I just want to clarify, that is the monitoring, not the contact tracing. So we are contact tracing and we're calling people who are in quarantine, but as far as following up with them every day, we were doing that by email. And as I said earlier, we've lost that ability to do that, and we hope to get it back in the next few days. So it was working really well. And it's not just us. Johnson, Sedgwick County, they experienced the same thing, so.
So you can see, it's not a terrible situation. We have a lot of greens, and that's good. We have a few yellows, which means that we are already in warning zone, and so should we experience a sharp increase, even if it's just for 1 week, of cases, that would put the health department in a difficult position. But right now, I think we are doing pretty well. So let me transition then to what I see coming in the next few weeks. So you've seen this slide before. That's what we presented 2 or 3 weeks ago, I think. We were discussing whether to move into phase 3 or not. And those are the criteria that we said we would use, is how many cases we have, the rate of growth, and we talked about that. Right now it's about 1%, which means you are doubling. If that rate continues, it means we would doubling cases every about 40 days. So I really hope that we go lower than that, because I don't think we want to have 140 cases a week as opposed to 70 or 60 that we have now. And then the last item was the projected ability of the health department to investigate cases, contacts, and outbreaks, and that's the scorecard that you just saw. So that was a general overview back 3 weeks ago, what criteria we would use, and we decided we would move into our phase 3. Something else that I want to remind you that we discussed before, there is a lag time of 4 to 6 weeks to see the impact of any kind of modification that we make in our restrictions. And so to help you adjust those dates, we have just now seen the full impact of going to phase one. Now, who remember phase one? It feels like years ago, right? It was just about 6 weeks ago. We are just now starting to see the impact of phase two, Memorial Day, and we haven't really seen any major impact of what we decided to do for phase three, just because of the lag time. So there's something to keep in mind when we discuss what should be next. I think that keeping in mind that the state plan and the county plan really don't have a phase four. What they have is 3 phases to reopen, and then something called phase out. And phase out is just what it sounds in the name. It means essentially we're just vigilant, we do monitoring, we have almost no restrictions in the phase out. Given the numbers that we have now, I don't think we are ready for a phase out. I think we are ready to keep some moderate restrictions and maybe lift a few of them, and I will tell you in a moment which ones. But essentially what I am strongly recommending is that we stay the course for another couple of weeks. And in particular, I want to keep in place the mass gathering, the social distance, and the high risk, the restriction of high risk activities and businesses. For how long? This is what I see as the end point for our phase three. Number one, we have a caseload that's stable. So I show you the first chart. Looks like we are getting stabilized, but it's too soon to tell. Again, 3 weeks ago, we had one of our, actually, I think it was the highest peak ever in number of cases. And it's now too soon to see and tell whether we are stable or not. Number two, we want to be sure the health department has enough resources to take care of those cases and some increase, because we know that the curve is going to go up and down. The trend may not change, but even just from 1 week to another, for whatever reasons, if we have a cluster of cases, for example, in a particular place, for that particular week, caseload will go up. So the health department must be able to handle that. You approved the contract for contact tracing and case investigation today. I think that's going to be really important to help the health department cope with this workload. But we won't see the effects of that contract for another week or two. After that, then we can go into phase out. And you know, as I said earlier, phase out essentially means no restrictions for anybody. I recommend that we revisit this in 2 weeks. I don't know if at that point we will be ready to go into total phase out, but hopefully at least we will be able to assess whether there are more restrictions that we can lift. The restrictions that I am recommending we lift are those on retail businesses. And so that includes things like disinfecting cards and the use of masks on employees and things like that. Now, I want to be really clear. I'm not recommending to do that because I don't believe that those are bad practices. So I would still highly recommend that retail businesses follow those practices moving forward. In particular, the masks are extremely important. We had that conversation last week. Every week, the bulk of evidence in support of using masks is one of the tools, not the only tool, one of the tools to prevent transmission increases. Just last week, there were 2 other papers published in major medical journals supporting the use of the masks in public. Just today, I was hearing that the chairman of the Federal Reserve of all people said that a consistent use of masks will be one of the 3 factors that he sees as contributed to a faster or slower economic recovery in the nation. That's an economist talking, so I guess it's the recognition of the fact that without masks we will have more transmission. So the fact that I'm recommending to remove the restrictions on business is not because I don't think they are important. It's because I really want to continue doing what we have been doing all along, keeping our restrictions at the very minimum that's acceptable to keep the balance between restrictions on individual businesses' conditions and protection of the health of the public, which is our mission. And at this stage, with the numbers we have, I don't feel like those recommendations for retail business are necessarily needed to be restrictions. But for everyone else, we are talking mass gathering, social distance, you are talking of the high-risk activities like personal services, barber shops, your cosmetology shops, bars, restaurants. We haven't even seen anything about the effect of reopening bars because it was just this week. Just last week, I'm sorry, so not even 10 days. So still too soon to lift those restrictions. So I think that those restrictions should remain in place. That's all I have.
I don't disagree that masks help, but are these studies, are they based on masks that they use like in hospitals and worn properly, or are they based on studies, the way people wear masks in public, where a mask would, where it's below their nose, it's
Right.
around their neck, hanging from an ear?
Right.
And they're touching their mask a lot, and they don't wash them very often, and they're in their pocket 1 minute, then they put them on, they take them off, and they're in the car for a while. Oops.
I
But
just removed mine.
are these
Made
studies done,
self-conscious.
are these studies done on people like that, or are they based on hospitals or in a more controlled
They're
environment?
usually, each study is different, of course. They're usually done in multiple environments, but not just in hospitals. I mean, there are some studies that were done in hospitals, but the assumption is not that people should use hospital-grade masks. In fact, that's not a recommendation because there is still some shortage of that equipment, and that should go to hospitals and healthcare providers first. So most studies include a mix in their population, which includes also cloth masks. Now, you are absolutely correct. A mask that is worn behind or under the nose does very little. So masks have to be worn appropriately and correctly. They need to cover both nose and mouth. And they're not perfect. They're not a substitute for social distance, and they're not a substitute for keeping the size of mass gatherings small. It's just one more tool that helps decrease the transmission.
I think gives some people a little false sense of security, and they tend to get closer to somebody
Yes.
because they.
That is a risk. That is a risk, Commissioner. Although I was
There's maybe a
intrigued by,
trade-off there, I don't know.
there was somebody who did a study actually, and it was a social science researcher, and he found the opposite about, not about the false sense of security, that was not the object of the study. His assumption was, his expectation was when people wear a mask, then other people will feel, or the person who's wearing a mask will feel like they can come closer because they have that protection. He actually found that it was going in the opposite direction. People tend to be a greater distance if someone else is wearing a mask, because they recognize maybe that the person doesn't want a close social interaction, but for whatever reason, that particular study didn't go in the direction that they expected.
Any other questions?
Not on this.
Okay. Does anyone else want to speak? Sure.
You have to come to the podium.
Come to the podium, give us your name.
Okay, I just want to make sure I'm understanding correctly. I'm sorry, Tammy Hunt. That this change that he's recommending is only a mask recommendation only, not required, but a recommendation only for everyone, but there's no change in the mass gatherings or anything else? Is that correct?
So I guess, Dr. Pizzino, is there any recommended change from last week to this week?
Yes, the change I'm recommending, and I don't have the plan with me, but the plan has multiple sections. One deal with mass gatherings, and then you go into the businesses. The only change, there is a category in that plan that says retail business and has 5 or 6 bullets, one of which is employees who are in contact with the public should wear a mask. I recommend that we remove that section. However, there are separate sections for specific types of businesses, and those are personal services, so the barbershop, cosmetologist, gym, fitness centers, restaurants, bars, What else am I leaving out? I covered them all. Those businesses have their own restrictions, which include also using a mask, and that restriction will remain in place for those categories. But everyone that does not fall into those categories, those requirements now would turn into recommendations. So your grocery store, your hardware store, right now, the employees are required to wear a mask. They wouldn't be required next week. But your barber is still required, and you yourself are required to go to the barber.
Next week, is it Monday? Is that what you're,
That would be, yeah, that would be, yeah. We said we would stay in phase 3 for at least 2 weeks, and those 2 weeks expire midnight on Sunday.
on Sunday, and then we would go to,
Well, that
To,
would.
it would be just, you know, I honestly, I think we should move away from this numbering of phases, because at this point, it was helpful at the beginning. This point, it doesn't help, because what I'm envisioning, probably if I come back in a couple of weeks, I don't have my crystal ball, but envision a similar situation where I'm gonna tell you, you know, I think we can remove this and this and this restriction, but I would recommend we still keep that and that. So are we then in, what, phase 3.5.2? I mean, it becomes very confusing. There is nothing past phase 3 that has any restrictions, so that's why I'm recommending that we just remove those numbers.
so I'm a little confused here. So are these, from the sheet I got, are these mandatory requirements or are these recommended requirements at this point?
What you see in the tables,
Yes.
those are required. What's contained in the table, that was part of a public health order issued 2 weeks ago and became effective Monday last week. What you see in the rest of the plan, so the narrative, there are additional things that are recommended, and those are just recommendations. But what's in the table, those are requirements. And so you have all these different categories, restaurants, bars. Nothing would change for them, but then you have one category that says retail businesses. So any business that does not fall into being a personal service, a restaurant, a bar, then those restrictions now would be lifted.
I've noticed a lot of other counties have lifted all their restrictions, well, some
Yeah,
have
some
lifted
of
their
them regret
restrictions.
that.
And what's this?
I'm sorry, I
Oh.
didn't mean to interrupt.
Even Lawrence the other day lifted a number of restrictions. I was surprised by Lawrence. Are we more dangerous than those counties?
No, not necessarily. We are not more dangerous. I don't want to send a message that we are more dangerous. When you look at infection rate, our rate is higher than in some of those counties, including Douglas County. So, but that's the overall rate since the beginning of the pandemic. I think every community has to move at their own pace based on the numbers that they see and based on their current situation. I'm not going to second guess what my colleagues or your colleagues in Douglas County decided to do. I can tell as far as Sedgwick County is concerned, for example, that you probably heard about that. There is a lot of debate now whether that was the right decision or not, and the state is very concerned about that. Same thing for Johnson County, Riley County. So I'm not saying they did anything wrong. I'm just saying that we need to adjust the pace at which we lift these restrictions to what we observe from the data. And if we do that in a consistent, slow way, it's much easier than to handle the consequences. I think what we have done in Shawnee County has been good in that sense, because we have moved progressively, consistently, and in the right pace. First to implement those restrictions and then to lift those restrictions. And I think we should continue to do that.
I'm kind of like Dr. Pezzino. I run the numbers a lot. Here, I'll give you things here. When I was using the June 17th numbers of Shawnee County Health Department statistics, I came up with 4.37% of the 10,340 tests were positive for COVID-19. So of those 10,000 tests, we had 4.37. That seems like a pretty small number. Of those, 1.99 of the ones that were positive, of that 4.37, 1.99 died. Now, we have a population of 177,943 people. I got that from the Department of Statistics, Department of Labor. Of our total population, that means that 0.25% of our population tested positive for the virus. And 0.01% of the population have died from the virus. That's a pretty small number. The statistics taken from the Kansas Department of Labor show our population, like I said, is at 177,943 people. 52% of Shawnee County's population is between the ages of 19 and 64. That's our workforce. And that comes out to be 92,530 people in Shawnee County. That's our workforce, that's our numbers. With our current unemployment of 12.1%, there are 11,029 people shown as unemployed right now. That's a bunch. That's a huge number. Then I look at our KDHE statistics for Kansas for June 17th, 2020. 8.2% of 142,254 people tested in Kansas were confirmed positive for COVID-19. 8.6% of those were confirmed COVID-19 cases in Kansas were hospitalized. That's of that 8.2%. 2.11% of those cases died. So we're actually doing better than the state as a whole. Our population of the state it's close to 3 million, but 0.4% of the Kansas population has been confirmed to have COVID-19. 0.03% of the Kansas population has been hospitalized due to COVID-19. That's 0.03%. And then 0.01% of the Kansas population have died. And I've said this before, and I'm not trying to compare Kansas flu and pneumonia, but we had 1,516 deaths last year with flu and pneumonia. Our current death count is 247 for the state. And I don't think we did anything for the flu pneumonia death, but we had a lot more people die from that. Just perspective. I'm not comparing the two as being the same disease. I'm just saying, just a comparison. Okay. The data doesn't tell much about the burden on hospitals. When they say that, when somebody will say 90% of the hospital capacity means nothing less than unless I know the capacity of the hospital. You know, if a hospital has 100 beds ready and they're using 50 of them, and you have 50% occupancy of those beds, we know what that is. But what if they have 10 beds, you know, all of a sudden? And I think that's what's happened in a lot of our hospitals. They start out designated a whole bunch of beds because early on we had a lower percentage of people that were filling our hospital capacity. And now it's gotten larger, but I think they have just less beds available for it. I think they've reallocated those beds for other uses. So without knowing how many beds they have designated for COVID, those percentages don't mean a whole lot. 1/4% of the population of Shawnee County has been confirmed to have the virus. That's a pretty small number. 1/10% of Shawnee County population has died from the virus. 1/10%. That's very low. As of last week, the total number of COVID cases treated in Stormont Vale was 42. That was since March 15th. That's total. The average is about 14 per month, or I could say about one case every other day. I I think it's really hard to tell how many cases we have. It's just, like they found 5 cases of people that they didn't even know they had it over in Lawrence the other day. We really don't have a good firm number of how many cases are out there. There's just no way of knowing. The only numbers we have that are solid are how many people have been in hospital and how many people have died. And if you look at a chart of that, we have been very low and even going lower, it looks like. And those are confirmed numbers. That's measurable. We can measure those. Confirmed cases, we have no idea. We can kind of get an idea, but when you only have 20 cases or 14 or 10 cases, that could be wildly off in a population as large as what we have. So, anyway, it just seems like to me we're very low on these infections, and I have to know what the end game is. What percentages are low enough? When we have 1/10 of people have died, what number, how low does that have to get before we quit?
And,
Yes.
Mr. Rupon, I appreciate the time and the work that you've put into preparing the document and doing the research that you've done. Time will be the teller of the truth. And it's not until we have a full picture, it's very difficult to see something when you're this close and we're in the middle. After time, we'll be able to see what we could have done or what we should have done or what worked or what didn't work. That's what researchers will be looking at for decades, if not for centuries. And much in the same way that researchers looked at prior pandemics and prior outbreaks, researching polio, down to the chicken pox, everything is researched. And so whether or not, I think your question goes to, did Shawnee County overreact? I think your questions that you're asking is, did Shawnee County overreact? Did the governor of the state of Kansas overreact? Did the president of the United States overreact? Is all of this an overreaction to something that is of minimal impact? And part of that we won't know because of the steps that we took into place. And because you could go back to, because of the steps we put in place, we have not had the impact that other countries did, Italy or China. And so those are going to be theoretical questions. And so I appreciate the theoretical question, but the very last sentence in your document, what is the end game? And does Shawnee County go back to a pre-COVID, no restriction environment? I think that's your actual question. And on that, we are moving towards that direction where just today, Dr. Pizzino has indicated that it's his recommendation to lift the mask requirement for all but a few establishments. There's not a business that's not open. All businesses are open. Now what we have to do is we are in a spot to build consumer confidence. I think it's our job as the community leaders, as the county commissioners, to build consumer confidence that we have to respect that there is a virus in our environment. We have to respect that there is risk, do a risk assessment, take reasonable steps, but to resume life. And I think that's really where I view that we're at as a county, is that we are all but completely back to a pre-COVID environment.
I'm not questioning what we did. That's not what I'm doing at all. I'm trying to find the end. And I would argue, too, that we know a lot more about this disease and how to treat it than we did at the start. We know a lot more. We know how deadly it is, and how, I don't want to say how deadly it is. We know the percentage of people who die from this that get it now. We know that. And that, it's not as bad. You have a almost 99% chance of surviving if you get this, so we know that.
But why were countries such as Italy impacted in a much more disparate rate?
I don't think they were ready when it happened. I think it just kind of jumped on them, and I think they had a lot more exposure to the virus than a lot of countries due to the people working in their country. They had a lot of people from China come in there to work. They went back for their Chinese New Year and then came back, and I think it was kind of the perfect storm for Italy. Italy also has a little higher age population, and we know that people of higher age, it affects them more. But I get, my question is, okay, I see these numbers. We aren't overwhelming our hospitals, and that was one of our goals early on. We didn't want to overwhelm our supplies, we didn't overwhelm our hospitals. We're not seeing any of that. And I don't think we're any more dangerous than any other county, and a lot of these have opened up, and I just feel like we ought to, I don't mind these restrictions, or these comments in the back, but I think they ought to be recommendations rather than restrictions. And so that's my point. And that was my point in saying all this. I just don't think the number's there to justify keeping our thumb on things as tight as we have. And then when you talked about businesses, they're all open, that's true, but when you're at 50% and you're a restaurant, you're probably not making a great profit. You're probably not making anything. And it's some of these restrictions that I think are hurting our economy. We have 11,000 people unemployed. You go into a restaurant and they said, oh, well, we have half the tables closed. We only have 4 waiters working tonight, or waitresses. And that means another 4 sitting at home and a cook or whatever. They're not getting paid.
There are also businesses that are impacted in that their employees are making more now on unemployment than they were employed, and so there's some reluctance to return to the workforce.
If they're fortunate enough to get through the state system and
If
get
they
onto
were.
their,
And so-
that has been an abomination.
And that was a report made by our county Parks and Rec director. And that's how Shawnee County was directed. That's not anecdotal, but that was actually a report made by the Parks director last week, to the Shawnee County Commissioners, so.
Well, anyway.
Commissioner, I'm not going to dispute most of your numbers, but there were a couple of things that I heard that I would like to specify. First of all, see if I can remember them all now, but you said there is no way for us to know how many cases we have.
We don't. We can't.
I disagree. This is how many confirmed cases we have. These are many confirmed now. If we're
Confirmed.
talking about infections, that's a different story.
We don't know how many people are infected. We have no idea.
Okay, but that's different from knowing how many cases. So this is a minimum. You know, at the very minimum, we
Right.
have these numbers, this number of people that were sick.
We could
Most
have a
of them were
lot more
sick.
people, and we know there's probably more people out there that have been infected that didn't
Sure.
even know they had it,
Sure.
which
Sure.
which
I don't
even
disagree with you.
which even brings the numbers down lower.
And then the other thing you ask, what is the end game? I think
Yeah, you hit on it here a little
think
bit.
I should, I told you, and you know, with all due respect, I will send the question back to you. What is the end game in your opinion? Or the beginning game, perhaps? How many people do you think should be sick? How many people should be hospitalized? How many people should die? Before you say, public health, we need to do something about this.
I'm-
Because, excuse me, just one more thing. The example about influenza, that was the other thing that I meant to say, that I dispute your statement, we do nothing about that. We spend hundreds of millions of dollars every year to prevent influenza, and we are partially successful, only partially successful, unfortunately, because the vaccine that we have is a very lousy vaccine. But if we didn't have that in place, you would see very different numbers. That's what public health does. Our mission is to try to prevent morbidity, mortality, and you know, all the consequences, economic and social, of people becoming sick. Now, there is a fundamental issue that I think as a board you need to address. Do you want to support a public health approach to this pandemic that tries to contain the effect of the pandemic to a point that is manageable, not to prevent all the cases? Nowhere does it show
We
here,
can't
we need to
prevent 'em.
stop all the cases, right?
We can't prevent them.
Right, that's what I say. End point, number one, caseload stable. I didn't say stop all of them. Do you want to support that approach, or do you want to support a different approach? And if so, what is that approach? And I think, pardon my frankness, I think you owe it to your health officer, to the health department staff, to give a clear question as a commission which direction you want us to go. Because frankly, these are the same numbers I heard last week. And my opinion has not changed on those numbers, and probably neither has yours.
I've always said all along, we need to protect the vulnerable. And you said, we're not testing people in a lot of the nursing homes. That's an area I think we ought to be doing more testing, because they are the most vulnerable. Over the whole United States, about 50% of the people who have died have been in nursing homes. And we've done a good job, but there's one area I think we ought to focus on. The working age group, they survive this. They have a huge survival rate. And to me, we need to open up our business more. We got 11,000 people without a job right now. And the impact of that, health-wise, is going to be huge if we don't get them back. We have people that they're putting off medical procedures or whatever because they don't have money. And there's that collateral damage too, and we have to worry about those people as well. They're part of Shawnee County. And there's probably a lot more people being affected by being out of work than people being affected by the virus at this point. But what are we doing for them? What do we do for those people? They're important to me too. And I don't know. I just feel like we need to get the economy going. It could be the best thing we can do for the virus in some ways. I don't know. Go ahead.
Well, with all due respect, Commissioner, I feel like we are doing things to spur the economy. And I don't understand how requiring a server at a restaurant to wear a mask is hurting the economy in any way.
I'm talking about the 50% occupancy.
We don't have a 50%
I
occupancy.
thought I read that right in
It's
here.
only for bars, not
Only
for
for
restaurants.
bars.
Well, for bars,
But they just reopened a week ago.
but I go into restaurants and they have every other table taped off
Yeah.
or whatever.
And
So, but can they function like that?
Well, but even the ones that are not taped off aren't full. I mean, I've been in a restaurant at least 2-3 times a week. And,
I've been
perhaps
in
because I'm
some
not
where
that great
I
of a
have
cook.
been in some where they were out of tables.
But I have not been in any restaurants where there's a waiting line to get in. And
And are we scaring people off by doing that?
That's a bigger question than us.
Yeah, well,
I mean, I think in these numbers here, you have 0.25% of the Shawnee County population is tested for COVID-19. You also have 0.40 of the Kansas population. That's a pretty big discrepancy. And I think that shows that we're doing the right things here to protect our population. And the fact that we've not had, you say protect the vulnerable in the nursing homes, we've not had a cluster in a nursing home. I think we
we're
are.
lucky. I think we're lucky
Well,
too.
perhaps luck plays a factor.
or maybe we are working hard for that. I'm
but,
sorry. I take issue with the
But
statement.
that's my main concern, is protecting the vulnerable.
Yeah, and we have been doing that.
Yeah.
But
It's
I-
not just luck.
I think that every time we come to these meetings, we lift some restrictions. We've done that consistently. Every time we meet, on a weekly basis, we've lifted some restrictions. And I like that approach. I want to get to a point where we don't have any restrictions. But, before we, do a cannonball and jump into the pool, it might be good to dip our toe in every once in a while and check the temperature. I mean, I think that what we're doing is we are consistently pushing the envelope just a little bit further. Every week, we come back, we lift it, last week it was the bars. We lifted up to 2,000 people can gather now. We're getting to that point. And I agree, we need to get rid of talking about phases, because the phases were developed a month and a half ago. And, they designed these, but really, it was a guess as to how things were going to proceed. And I think the more we learn about this, we're seeing maybe we can do this, maybe we can do that, but we're still kind of pushing this envelope a little bit further every time. And I think to just make recommendations on some of these things, mass gatherings, I think are something that we still need to restrict. I still think that, you know, people that are hairstylists and things that are, you know, literally touching other people. I mean, was it the Great Clips that was in Missouri where the lady saw 90 some odd people in one day and she had COVID? Luckily, they were all wearing masks, you know, and I think that if we lift those restrictions, I think we're liable to get back up to where we don't want to be. And so I'm happy that we're removing the restrictions on retail stores, but I still think that we have to have some restrictions still. And I mean, I would encourage you and emergency management to continue to lift these restrictions as we see fit, but removing all restrictions is something I just don't feel comfortable with right now.
You wouldn't be comfortable with them being recommendations like a lot of counties have done. Let the business owners make their decisions.
I think it's a
They're the
slippery
ones taking the
slope.
risk on their business, so.
Well, they're taking the risk on their
They're
business.
taking a risk, putting their life savings into businesses and stuff. Let them make some of these decisions. Give them the recommendations. They can follow them if they choose to. If you choose not to go into some place where they're not wearing masks, no one's forcing you to go in there.
Currently, though, Commissioner, with all due respect, the businesses are able to open. We have been reopening. They've been coming back.
50%.
And so, when we talk about maybe if we could just get a clarification on restaurants. I think that's what you keep coming back to restaurants,
Sure.
being on a borderline income, highest risk is on restaurants. Can we just have a clarification today as to, Dr. or Dusty or Linda, exactly the restrictions on restaurants as they currently stand? And then if there's,
Yeah,
and
it's
as
in
they
the
would
back of
stand on Monday.
There are no restrictions in terms of, 50% of capacity or anything like that. That's only for bars.
But doesn't it have a
6 feet.
6 feet?
Right, I was
distance?
getting there.
Okay.
Yes, there are restrictions that they have to respect, the 6 feet and the mass gathering of 45 people. So what the means in practice, they can have a party of people walking together, whether they're same family or friends, it doesn't matter, up to 45, they can be together around, in the same area of the restaurants. I don't want to say around the same table, I can imagine 45 people around one table, but I hope you understand the concept. Then everyone else needs to be distanced 6 feet apart, whether it's a group of 1 or 2 or 45. And so that's really the criteria, is to have groups of no more than 45 people at the distance of at least 6 feet from each other. And then the people who are in contact with customers, so the servers and the hosts, will have to wear a mask.
And aren't they supposed to wash their hands in between each?
Yeah.
And
No,
how
is
many?
it too much to ask to wash your hands?
No,
in
but
between?
how many, wash their hands between each customer?
Yeah.
When they go,
What's
how
the
often do you think
sanitize?
that's happening?
Would you like us to enforce this a little bit more strictly and send the police to check? I don't think we want to go
No,
there.
I don't think so. My point is, it's probably unenforceable.
There is a lot of evidence, Commissioner, that when we make things as a legal requirement, the vast majority of people will obey. Most people want to do the right thing.
Okay.
Imagine what would happen if we would make the red light optional and not a requirement. It's a requirement, people stop, most people. The few that don't, some get caught, some don't.
Yes.
I'm looking at the restaurants, there isn't a 6 feet requirement except for counter service. The adjacent
It's the first
bar-
bullet,
adjacent-
Commissioner.
It's
It's social distancing, that's what it's called. They can operate subject to limits on mass gatherings and social distancing. So the social distancing means 6 feet.
Well, originally, didn't we when we first went into phase one, I believe it was, of the governor's plan, and actually it wasn't even our plan, it was her plan at that point. They did have guidances, every other booth, or you'd have to have some kind of a plexiglass a barrier between the booths. And I know that there are some restaurants that have actually retrofitted. I was at Red Robin with my kids a few weeks ago. they built a whole wall in the middle of the restaurant so that people wouldn't be in adjoining booths. And I, commend them for that. That's quite an investment they made. So, I mean, what can we do to say? I mean, honestly, at this point, when we have adjoining booths back to back with another booth, I mean, the likelihood of the virus going, from the back of my head into the back of the head person behind me. I mean, we may not be 6 feet apart, but we're facing different directions. I mean, is there some leeway on that type of a thing so that we don't have to have restaurants that have every other booth shut off? Or, I mean,
But we never told them to do that. I think that respecting the social distance of 6 feet remains a critical point. How they do that, I don't think that's the kind of business we want to get into, because then we are really going to micromanage how they implement our requirements. How they do that, it's really up to them. There is a variety of things that they can do, including what you mentioned, that are very expensive.
I've been in numerous places where every other booth is blocked off. And
It's one way to do it.
But that cuts your profit quite a bit.
I can address that just a little bit. You're just kind of touching around it. When that plan came out and they talked about 6 foot distance or social distancing, the caveat to that is if you cannot, and we went right back to the booths that were facing opposite directions, if they put the plexiglass in there, having a barrier. That was, if you couldn't do social distancing, having a barrier in between. That's where that came from. And that was out of the governor's original plan. And most of the guidance that you're talking about was just at the very top of all the tables, it was general guidance for all businesses. So some of that's the stuff you're referring to, and I don't have that plan right in front of me.
so those
but
were recommendations then?
Initially, those were the general
guidance?
guidelines, but it was describing what social distance was. It wasn't a requirement coming out of the governor's plan initially for those things, unless it was restaurants will provide social distancing, which was either the barrier or the 6 foot, those kinds of things. I know it's
Well-
kind of confusing without having it in front of me, but.
I mean, I'd like to try and do what we can to get restaurants back to full capacity. I mean, if that's a big concern, if we can get restaurants and bars back to full capacity at some point, that would be my ideal situation. And, I mean, my concern is that, we need to, I don't want to just do it on a whim here today, because I like to be a little more calculated in decision-making than just, on the fly. A concern of mine, though, is if we wait 2 weeks, that, I mean, look, I understand that you guys put a lot of time and effort into these presentations, and I don't want to make you to put together a whole new presentation week after week after week after week. But if we could perhaps address that and come up with some wording that might be able to be just a little bit more flexible with restaurants primarily, so that they can operate at a larger capacity. I mean, would you guys be willing to work together on that? I mean, I know that.
I'm not sure
Okay.
what you mean, because I work with them.
I know you
I talk
do.
to them, so
I
I'm
know
trying
you
to-
do.
what
You talk
language-
to individual restaurants,
Right.
but not every restaurant feels comfortable calling the government and asking for permission to do things. And so I know there are a lot of folks that just go by what we tell them through the media. And so I feel like, I don't know, maybe we could talk after the meeting and kind of get to a point where,
If you have some suggested language,
I think I do have some suggestions, but again, not ready for prime time language, so.
Aaron, Commissioner Mays, Mr. Rippon.
Sure.
Perhaps maybe what you're looking at specifically is looking at and revisiting the seating capacity, and specifically on the rules on social distancing and clarification as to what social distancing is and what is a safe practice or what is an acceptable practice, and a recommendation or requirement as to that social distancing.
Sort of. So I think right now what I'm most concerned with is that I feel like there are restaurants that feel they have to operate at half capacity. I feel like it's even though that's not in the restrictions, I feel like it's a common misconception. And if we could come up with a way that tells them it's, that it's spelled out publicly that they don't have to operate at half capacity. And maybe they did at one point, but I don't remember it ever being a requirement. I think maybe in some cases it's self-imposed, I don't know. But, I mean, it seems like that's a common theme, that we're forcing restaurants to operate at half capacity, and we're not. Is that safe to say? I mean,
It's kind of the first time I've heard it put that way. I mean, we're always fighting the rumor control thing. So if it's out there like that, and they don't understand social distancing in the way, in the methods, although Dr. Pacino specifically, but we can work something, I'm sure.
I go into a lot of restaurants and they'll have they've thinned out their tables and booths, every other one's taped off.
So
So they're half capacity.
as usual, we will always, work with you if you have any recommendations, and if there is a need for a clarification, we can certainly issue a clarifying document to explains more about social distancing, because I know it can be confusing. But I have to tell you pretty clearly, there are really three main elements on us: social distancing and use of masks in high-risk situations. Those are critical. And so if you want to call another meeting to discuss in a week, I'll be here, as I have been every time you ask. But, I hope I don't come up, maybe I will come up as being stubborn, but I have to warn you. I can't even imagine coming in a week and telling you that we can lift any of those three elements after 1 week from this discussion today. 2 weeks, possibly, but we can't tweak this thing every week. That's my point. This is a machine that's very complex, and we need to give the machine time to work, to function, and to spot where problem areas are, and then to fix those. But I don't think there will be anything new next week, to be honest, unless you have some specific language, Commissioner, that you want to recommend, and then we can have the conversation. But those three elements, please keep it in mind: mass gathering, social distance, and masks. Those are the three pillars, really, for our mitigation strategy right now.
What about mass gatherings for like a protest? How do we do anything?
How would you regulate it? How would you control it?
Well, that's true of almost all this.
Yeah, as far as the protests go, the rules still apply. I mean, we want to watch the mass gatherings in groups of pockets of 45 people wearing masks and social distancing. As you've said numerous times, that's not quite enforceable.
Unenforced.
And it's out there, but that's also not a business. And it's outside, there's other elements to that as well. But we're not in that, into regulating those kinds of things. But the rules still apply across the board.
Speaker here, your comment?
Well, I do appreciate all this discussion. It is encouraging and it's helpful. And I am thankful that the masks are going to be a recommendation, not a requirement. It's dividing people. But I think one thing that we need to talk about, a couple things. Dr. Pacino had said that by and large, people want to obey these rules. And I would totally agree. People do. They want to, stay within the guidelines and they want to be careful. However, there is far bigger concerns in our community right now than of a death rate by a disease, a virus that may not even be as big a thing as we think it is. We don't know, and I understand that. But the whole point of some of these restrictions is making the general public feel oppressed. The Black community is standing up because they felt oppressed for a very long time. Maybe not some things that are specific, but the feeling in that community is there. I'm raising 3 black children, and this is a very big thing for me. I see this as the same thing as an oppression, because we're not allowing our community to make our own decisions as to what's best for our businesses, what's best for our families. Is this oppression going on? People feel it. We are 4 months in, and this is starting to feel like a slow death crawl. It's been feeling like a slow death crawl. Kansans are capable of making these decisions on how many people to gather. And I do need to understand that it's, and correct me if I'm wrong, we could have 200 people in the same vicinity if we keep in groups of 45 with 6 feet apart. Is that correct? Okay, okay, but again, that is a control issue that people don't need. We don't need that. And there are people that are not going to gather in those large groups because they don't want to take that risk of the virus, or they're going to be people there wearing masks, and that's great. But this is that 200 people together, as long as you keep a group of 45 over here and a group of 40, it's like being in a corral, in different corrals within 6 feet. People can make up their own mind, and they will. The mental stress and the emotional stress that these kind of things that you can skirt for people, and it's needless. If we can have 200 people in a field, why corral them? It's foolish. And we need to move past those things. I appreciate all of the work that goes into this, and I do appreciate, Dr. Prezino, the work that you do. But Kansans do need to have their own decision-making process. We have gone through, we have done everything that you've asked us to do because we do want to follow the guidelines. But when the guidelines continue to be ridiculous to some extent, we need to examine that. And I appreciate the fact that you're talking these things through. And I just ask that you remove some of these things. That mass gathering restriction is foolish if you're talking about an unlimited number of people together, as long as you keep groups 6 feet apart. There's no way to do that realistically. And it's not, the businesses need to be able to do their own thing. They've got a stake in our community. They've got a stake in their own business. And that's who needs to be in charge of their business. The mental and emotional health of people throughout this is just as important. And right now, it is more important than anything else. My son-in-law is a firefighter. Every day, he is going to more than one attempted suicide or a suicide. Do you see that in the news? No. But he's doing it. There's a problem. It feels like we're being put down and kept down. There's a way around that without a rampant upswing in anything, and it's called allowing people to make decisions for themselves. Thank you.
Commissioner?
Yes.
We don't live in an anarchy. We have rules and regulations. The county sets speed rules on county roads. We don't have you can go as fast as you want on a county road. Matters come before us from the Public Works Department on recommendations for speed limits, for whether or not there should be signage on stop signs. We have regulations from the state as to restaurants on health practices, food preparation practices. We have regulations from the federal government on purchases of firearms or purchases of items. And so we live in a regulated society. That's part of the rules. We have limits, restrictions. And so I don't think we're ever going to be at a spot where I feel sometimes is the argument being made. Let there be no rules and let us all do whatever we want whenever we want it without disregard, because my public safety may not be the same as your public safety. And so I think that there's a balance between over-regulation and no regulation. And so I think we are in a safe place. We are in a balanced environment. We've been in a balanced environment. We're working towards a reassessment on a regular basis. But with the comment about the stress with suicides, attempted suicide, increase in mental health, This morning I asked Linda Oakes to prepare maybe a press release to go out as soon as possible. I would like to know the exact number of, have we seen an increase in suicides in Shawnee County since January 1? Looking at January 1 as our benchmark. Have we seen an increase in attempted suicide hospitalization since January 1? Have we seen an increase in domestic violence cases with the Topeka Police Department or Shawnee County law enforcement? Have we seen an increase in person crimes since January 1 with the Topeka Police Department, Shawnee County Sheriff? I think those are the items that we should be reaching out to our mental health provider. Have they seen an increase in crisis care with our mental health providers such as Vallejo? And again, going back to January 1, are we seeing an increase, a decrease, or is it static with what we've seen in years past? And Linda, would you be able to prepare that for us as soon as possible?
I would be glad to, Commissioner. We will get that information and get that out.
So I think we need to look at what has been the impact in the mental, in suicide, in domestic violence, in crime, and I think that we need to look at how the virus and the reaction, or treatment of the virus has impacted those other areas, because I do hear that repeatedly, that there's an increase in suicide and attempted suicide, and I don't have any media or newspaper numbers to report that.
Thank you so much.
I'm not an anarchist. I believe in the country of laws.
And I don't mean
But
you
I-
necessarily, but there are people that we get hit with, make no rules on me.
No, I think it's just, these aren't laws that we're used to living with. They aren't. And I think people would like to get back to a more normal setting. And I think at some point they feel like, I'm an adult, I can make my own decisions. I don't need these rules. And I think that's my point. So, anyway. Do we have anyone else that'd like to speak? Well, I'd like to make a motion then. I'd like to make a motion to change this order to recommendations rather than restrictions. No second?
Again, I'll say that there are pieces of this that I would probably go along with that. To do the entire document as recommended, I don't feel comfortable with. But, I mean, again, there are things on here that I would love to change, but I do think it needs to be a more calculated approach than just everything.
Well, the motion dies from lack of a second. For the 11,000 people without a job right now, I tried. So, thank you. Are we adjourned? Anything else? We're adjourned. Thank you.